Hey, what's up, everybody? Welcome. Thank you so much for coming today. Really appreciate this. Henry is going to give a presentation on the first meeting that you should do for the year. And this is something that, Henry has been a mentor of mine, and I don't think I ever like to share that enough that him and I were in a similar practice period in our practice's growth. And Henry was somebody who I leaned on for a lot of the things like communication. So like this was something that he invented, like this is how he likes to do his meeting. This is how he likes to implement EOS. If you don't know what EOS is, that's entrepreneurial operating systems. Comes from a book called Traction. It's just a way of running your practice. And the whole like basic tenet that I take out of it is that you're creating leaders and you're creating accountability in your team. You're giving people roles. You're being very clear. It's a way of being clear and telling people what they're supposed to do. And also letting the training wheels come off enough so that they do it and you hold them accountable to the result. One of the things that we see a lot, and I see this in coaching clients, I see it often in their teams. Like we'll have a very highly skilled front desk person. Okay. And that highly skilled front desk person will be the answer person for everybody in the office. And they'll go to that person. They'll see something in insurance they don't really know. They go to that person, and they go to and they say, "Hey, wait, what is this?" And that person just gives the answers. And then this is a very valuable person on your team, but then they're constantly answering questions from everybody. And the reason being is that everybody relies on that person. Nobody has to like own their results. They can go and they ask that person, "Hey, should I do here?" And they tell them what to do. And if it's wrong, it's on that person. They told me what to do. So the team members don't typically have the accountability. They're not owning the results. So when you design your practice with this in mind, like Henry's going to share with us, it gives people the ability to own those results and to so be accountable to that. So you get really clear. So he's going to show us how he does this, and he does this with his coaching clients. He has them do this meeting, and he's going to go through exactly what it is. Henry, I'm going to pass it to you. Are you ready to rock, man? So if you just want to unmute, you can take over. But yeah, we're just going to get started, and then this will be recorded. If there's any documents that are related, we'll send these to everybody who does come to the webinar. All right, let's see where Henry's at here. All right, 1 second. Let me get Henry on here. All right. Well, we're gonna pause. I'm gonna see why Henry's having trouble. Let's see. Okay, 1 second, guys. Let me see what happened here. All right, pause it. Please, please, be patient here. Let me find out what's going on with Henry.
Hey, Paul, can you hear me?
Yep, all good, man. It's all yours.
Okay, so I had to do actually, hold on. For those of you guys who don't know me, I live by the beach. sometimes internet could be like a spotty thing. I'm starting to share a screen here. So can you guys see my screen? Okay. So basically, we have, as dental practice heroes, we pride ourselves on trying to make life easier for dentists. Dentistry is not easy, it's very stressful. And EOS is such a proven system that has enabled me to have a lot of success, a lot of stress reduction. And that's the main thing that you'll see as we're going through here. So the problem that we've had as as people who are helping clients is most of the time people say, well, you need a certain team. You need 5 to 7 team members at least before we can even think about starting, right? So what do we do otherwise? Are we just waiting? So I just want to go through this presentation here, and then afterwards we'll leave time to talk about it. Essentially, I've put this together and we've beta tested this with some clients. We've beta tested this to show how can we start it even if we have a small team, even if we have a startup practice, right? So basically, why is EOS so vital, right? So for those of you guys who don't know, and sometimes I take it for granted on our podcast, we just use EOS like it's any other term in the world. EOS stands for Entrepreneurial Operating System. It's a simple system and it brings clarity and accountability and traction to every day. Basically, it allows our team members to take control of their own work environment. Kind of like Paul said, we can't have one person that's so vital that it's going to leave us vulnerable, right? And I did this a few weeks ago. I asked about 50 dental owners who have implemented EOS over the years, and some of the most common answers that I'll get is, "Hey, it's made the business less stressful. Man, it's taken so many things off my plate." And the business is so much more proactive instead of reactive. How many of you out there have practices where every day it's like, oh, what's the next thing that's going to come to me? Is, oh my gosh, when's the next time that somebody's going to say, doctor, I need to talk to you, right? And I'll be, forthright here. What has it done for me? This picture that I'm showing you, this is a consultant that used my story in a dental seminar a few years ago. And I don't know if you can see it or not, but that picture to the left was my desk. My practice started in 2014, and it was a startup, 2 team members. Within 4 years, we went to $5 million and 4 dentists and 35 team members. During that process, there were some chaotic times, and there were times where I just hated being a dentist, and I hate going to work. We would fire a dentist, and I'd have to be the one who filled in the schedule. So eventually, I just had to figure out something, and EOS was my savior. It really, really was. So when I brought on EOS, we got things more streamlined. We came up with mission and core values that we're going to talk about. We created a practice that was team led, and they are in control of their own work environment. A lot of us think that we're going to implement this and the team's not going to like it. The teams love it. You're basically passing the baton to them and saying, hey, I want you to be in control of your work environment. Not many places can say that, right? Not many people that work can say that. I work in an environment where they let us kind of control our own environment in a good way. So it was instrumental for me allowing my practice to get to the point where it was stable and I was able to really move things fast. So again, I think I mentioned it. What's our struggle been as coaching clients is I think a lot of times, and Paul would probably agree with this, we knew that it was valuable. We knew that it was going to be like the next level that really bumped you up, but we really couldn't come up with something for even small teams. So I've kind of beta tested this myself, and Paul and I worked on this together. So we've come up with a solution that will work no matter what stage you're in. So there's no excuses, right? Any of us on this call, no matter how big or small your practice is, can do this, right? So it's valuable for everybody. If you have a team that's big enough, we'll kind of go one way a little bit, but essentially I'm tailoring this presentation to anybody, even if you're a startup, right? So today we're going to talk about a clean, practical way to launch this with your core people and build momentum. So who's with me? Hopefully all you guys. So this is a typical, Is my screen switching? It's not switching.
No, we lost your screen, Henry.
Okay. Okay. Yeah, like I said, I apologize. There is spotty
It's
internet
spotty, but
sometimes.
it's fine. I mean, I could tell the
Okay.
bandwidth is low, but it's
Well,
good.
well, I'm on my phone, so yeah, so basically, and I don't know if you want to, Paul, but maybe you can share that EOS document that we put together because that some of
Sure
that is
thing.
gonna, if you want to share that, that'll be more definitive. So
Yeah, give me a moment.
the typical EOS setup is where you have what's called a visionary. A visionary is the doctor, that's the owner doctor. And right below the owner doctor is the integrator or practice manager, but we call it an integrator. Underneath is where we have all of our team leads, right? So in a typical practice, we'll have team leads. Yeah. So, yeah. So if there's a picture of the team lead structure somewhere there, Paul, that's maybe they can see a little bit more, a little bit more. The one that has a picture,
There it is.
probably near the end.
Here it is.
Yeah, there it is. So I don't know if you can make that bigger, but that's essentially what our struggle has been. Like, gosh, most people don't have that many people. So in a typical dental office, the team leads are dental assistant, dental hygienist, an admin team lead, and a social director. In a really large practice like mine, I even have a team lead for ortho and for sedation, right? But again, what in the heck do small practices do, right? So you got to start somewhere. So basically, yeah, if you want to go to the start or the pick, like where it says step one, Paul,
Got it.
on that form. So basically, let's start. This is for everybody. You're gonna start with a small group. Think of this as your leadership circle, even if you're a team of five, right? Or whatever you looks like. Most people will start with obviously you as the owner doctor and then 2 to 4 team members. It could be two, right? I just want, even if it's you and gosh, I have a really great admin team member. She's always on top of things, even if it's you and one other person or you or 2 other people. The key thing is not the position, but who, what type of person are they? And then you're going to invite them. Paul, there's that book there. So, so step number one, you're going to pick your team. And I'll share this after we're done my PowerPoint so you can actually have it and makes more sense. You're going to pick your starter team. That's step one. Step number two, you're going to give them this book that is in this sheet here. It says, what is what the heck is EOS? We won't say this to our team, but it's a dummy proof. It's a dummy proof book that anybody can read, and it's really simple that tells you what we're trying to do. And
Hey,
basically all you're
Henry.
going to tell, yeah,
Henry, sorry to interrupt you. Did you want to just take like a minute and email me that presentation and I can share it from my end?
yeah, I can do that.
All right, sorry, but we're just gonna take a minute. I'd love to have this presentation going too, because I'll send like this document's awesome. Happy to share this with anybody who's on the meeting. This is we'll share this, but like I have your registration from you guys coming to this webinar. So give us just one moment here. We're gonna get this set up.
Yeah, we can blame it on living by the beach. That's the one drawback to living by the beach. You have a little spotty internet.
Yeah, it's all good. All right.
So, yeah, I'm attaching it here.
Let me know which one you send it to.
Yeah. You're putting pressure on me, Paul, right in the middle of
Yeah,
showing you my.
it's all good.
Hmm.
I think the people will forgive us.
Yeah, because yeah, my even my internet trying to send something is I'm wonky right now, so
It
it may
sucks.
not. Yeah, it may not work, man.
Are you sending it to my Paul Etchison or are you sending it to the Dental Practice Heroes?
Well, I'm trying to even get it's not even letting me share right now. We have just not really good internet right now. And I have like
Oh,
the most expensive internet you can have, but it's just
okay.
our service on.
You
Let
want
me
to
try it
rock
one
on the
more time.
document then or what? Up to you.
Yeah, we'll probably have to just do that.
Okay, I'll bring the document back up. There we go.
Okay, so we were at the point now where we've picked the team members, we've picked the people that we potentially want to be on our team. And again, it could be one person, it could be two people, right? Maybe two is good because at least you have some more collaboration, right? And now you're going to give them this book. The book is called, What the Heck is EOS? And again, it's a very simplistic book. They can read it, they can understand them. And basically, you're going to say to them, listen, I want you to read this so we're all understanding the same language. You understand what we're trying to do. And you're going to set the vibe of success, right? So now we're going to set up the meeting. Now, this is the mistake that some dentists will make. They'll do it during lunchtime. Yeah, you gotta get of the mindset that when you want this to work, that it's going to take a little time in the beginning. It's like a flywheel. You got to get the momentum. Momentum moves, right? So you're going to set the vibe of success. Make sure you block out at least 90 to 120 minutes for this. And basically, make sure there's nothing afterwards. Like there's clinical time that's going to make you work faster, right? You don't want that. Order food for the team. You're going to get some big whiteboard, either if you have a whiteboard in the office or big post-it pads. You're going to use those. I love the post-it pads. Staples and Office Depot has these really big post-its that you can put on the wall. And sometimes it's really good because you may have multiple things at once, and don't want to get rid of stuff. You don't have enough room. So I love the post-it pads. And you want this meeting to feel different from other meetings. You want it to feel like it's more energy, more ownership, and stuff like that. So there's also something called a core values word list that we have produced. And you're going to have that and enough copies for everybody to have, right? So this is important when you start the meeting. Yeah, so there's the core value list. And we'll kind of touch that a little at the end here, but leading statements. So this is important. This is really important. Right now, you are the implementer and you're the visionary. So you're doing both seats here. So you want to just keep it simple and you want to keep things so they understand and they understand this is a place of safety, right? Because this is something new. Maybe a lot of people that are in the dental assistant seat or admin seat, maybe they're high school graduates, maybe they had some college, but they've never really been leaned on. And now you're putting value and you're putting leadership traits into them. So they have to understand. You're basically going to say stuff like, hey, we're implementing this structure called EOS. It's a simple structure that will allow us to get organized. I want the practice to run smoothly so expectations are clear and where people feel proud of where they work. And this system's going to build this. A few rules up front. First, it's not adding any more work to anybody's plate. It's about making work easier, clearer, and more rewarding. Second, this only works if we're honest. I'm asking you to be honest and real with me and with each other. If something's not working in the office or we have problems, let's know. We can't fix what we can't name. Most important, this is a place of safety. You are safe here to say what you like. Nobody's getting punished for the truth. We're all on the same team. We're here to build consistency and stay focused every week. So this is vital. And again, at any time, you're always getting the buy-in. Yes. Does that sound okay? Are you on board with this? Yes. Hey, before you start it, you're going to say, hey, before we jump into this, you got the whiteboard up, you got the post-its up, and said, let's just come up with some things. What are you hoping to gather out of this? What are you hoping that this system will do for your workplace and your job? What worries you? As they're talking, just write this down, right? You're not going to defend, you're not going to correct, you're not going to explain. Just listen like a coach. So now that we've kind of got those things, and maybe you've got a little list, and again, I love the post-it notes. You've got a list of maybe some things already that aren't working with the office, that are problematic. So now we're going to work on establishing core values, right? Very, very important to establishing core values. They're not posters, they're not standards. It basically tells us who belongs on our team, who should stay on the team, what behavior gets celebrated, and what behavior gets corrected. Because when core values are clear, everything gets easier. So again, imagine this. You're in front of the room. You've got either a Post-it or you've got the whiteboard in front of you. And this is what you want to start to, it's going to be in the challenging in the beginning because it's not normal for them to just spit out information, right? As they get used to this, they'll understand the process. So first thing, hey, let's clone the perfect teammate. If we had somebody on our team that's the perfect team member, what traits would they have? And you're just writing these down, right? They may just say some things. This is the positive side of the board. And they may say words that repeat, and that's okay. Just tally them, right? So, yeah, what would be the perfect employee? Oh, man, somebody I could trust. Somebody who's always on time, right? Let them know. Like, keep coming. That's great. That's what we want. And then, you know what? What about the opposite? If we hired the wrong person for this practice, or we had the wrong person in working here, what would that look like? What traits would they have? And now you're writing those traits on another side here. And basically you're doing the same thing. You're coming up with a tally sheet, right? And so you notice a pattern here, right? We're trying to get them to say what's good and what's bad. So you're coming up with as much stuff as you possibly can. Now, Paul, if you go to the very end of that sheet there, so I like to hand this sheet out. It's the core value sheet. These are all, I don't know how well you can see it, but there's a lot of words and a lot of phrases. And you give this to them after you've prompted them to do these other things, right? So you've already got a list of words. Now you give them these sheets, and you know what? Take this sheet, take a minute or two, a few minutes, and circle 5 traits that you want in a team member and 5 traits that you absolutely do not want in a team member. And, there's a lot of prompts on there: disciplined, ethical, joyful, drama starting, right? Bad things too. So you're going to take that, and then now you're going to have more words that you're going to have out there, and there may be more tallies. So now we may be getting to a point where there's some words that are a lot more than others, right? Words that come up a lot. And a lot of times you'll get to the point, maybe you circle 2 or 3, like the ones that are coming up the most, right? And you may end up with themes. So when we just did this exercise years ago, we came up with 3. We came up with productive, trustworthy, and enthusiastic, right? And those ended up being our core values. And you can kind of tell them, listen, I'm noticing some patterns. It seems like productive, trustworthy, and enthusiastic are the most phrases that you guys would come up with. Does that make sense? Are you guys aligned with this? And then if they say yes, great, congratulations, you have got core values. And then what you want to do is, I wish I had my presentation up, is after the core values are set, those words, they're just words, right? You want to kind of wordsmith them. And we put them in our break room. So I'll give you an example, not to get too wordy here, but enthusiastic. On our break room, it says enthusiastic in big words, and on one side it says is. Enthusiastic is motivated, optimistic, welcoming, friendly, cheerful, cooperative, blah, blah, friendly, positive. Enthusiastic is not rude, pessimistic, hostile, negative, thoughtless, bad-mannered, and foolish. We believe in being enthusiastic. We believe in providing excellent care. I'm trying to make it smaller here, but it basically says if you are these things, great. If not, then you may not fit in here, right? So the end of the sentence says those who tend to be rude, pessimistic, hostile, angry, neglectful, complainers, or whiners may not fit in here. So it's kind of like your rules, your barometers. So if somebody does something in the future, like they're late, hey, that goes against our core values, because when you're late, enthusiastic, it's not enthusiastic because everybody's down and pissed off because now somebody's late and we got to work more. So make those core values, like if you don't have them already, this is a great exercise. And the best thing about doing it this way is you can always say, I didn't make these core values. This is the team. This is the team, what they expect in people, your peers, right? So, we also have a core value. We call it a pledge every morning, where basically all the team members, after we do our morning huddle, the team reads this, basically says, we are productive, we're hardworking, knowledgeable, cooperative, patient focused, we exceed expectations, go above and beyond, blah, blah, blah. So it's kind of like our Pledge of Allegiance every morning. Does that make sense to everybody? I know it's I'm trying to go with my own PowerPoint, and I know you can't see it. I'm trying to do as best as I can to try to explain, and I apologize for the internet there. So now we've established that we're starting EOS. They kind of understand what we're doing. We've got core values now. Now we're going to talk about a mission statement, right? So what I like to do is this is mainly going to start from the owner perspective. And a good thing that you can do is you can take ChatGPT and you can ask ChatGPT to look over all of your online reviews for your business and all of your online marketing content and put together some sample mission statements. I've done that for clients, and there's a lot of them that are pretty good, right? But once you do that, you're just going to tell your team, listen, why do we exist? What are we here for, right? And then you can tell them, hey, these are some samples that they came up that, I've come up with looking at our online marketing. What do you think? Right? Because it's always good to know your why. Why are we here, right? So I'll give you an example. My practice's mission statement is to change and improve lives in our community by providing quality care that's convenient and comfortable for everyone. It's a little wordy and stuff, but essentially that comes about because we're open in the evenings, so that's convenient, and we're comfortable. We have IV sedation and we have lots of patient amenities and stuff like that. So you got to make it your own. But I think in this case, ChatGPT really helps because if you've got a lot of online reviews, there's going to be, just like when we did core values, there's going to be things that tally. There's going to be similar things that people say and similar statements. And again, some people will print out their mission statement and put it on the wall in their office or somewhere. It's always a good thing to have, right? Everybody good? Yes. So, vision. So again, I'm trying not to, this is mainly doctor thing, right? So you have to think of what your vision is. Like a lot of us as, coaches, we want our clients, you guys, to have the least amount of stress. I would love to get everybody to the point where they're working 1 day a week or 2 day a week, making just as much money, if not more. So that has to be your vision. I like people to make their own vision, right? Um, hey, I want to not be working in 5 years. And this is you're going to share to yourself, right? This is to me personally. You're not going to tell your team, I don't want to be working in 3 years, right? But you can certainly talk about things like being profitable and I want the practice to grow and what's a measurable thing. When we do EOS and we have goals, it always has to be measurable. You can't just say, I want things to improve. No, that's how do we want to have measurable things. So I want to do 20% more Invisalign cases next year. That's measurable. That's a yes or a no. So now that we've got core values, we've kind of established an accountability chart. So yours is going to be smaller. So in this model that we're doing, you may have a visionary, which is you as the doctor. You may have an integrator, which is probably you also right now, which is okay, right? You got to start somewhere, right? So you're the visionary and you're the integrator. Totally fine. Now you may have a team lead, right? Some of these people that you've just picked because they're good people, you can just have they're just what we call advisors, right? They're just advisors. They're the beginnings of your leadership team, or Paul and I have been calling it a skeleton leadership team, right? And they have to understand that the rules is that when something comes up, the leaders are the ones, it should be handled on the leadership level first, right? And if it can't get solved there, then it comes up the chain. As your leadership team grows, then it's more important, right? Then it's easier because they see, hey, if I'm a dental assistant, I'm going to go to my dental assistant team lead. If her and I can't figure that problem out, then we go to the integrator. If you see where I'm going here, nothing should come up to the doctor, right? Nothing. If something comes up to the doctor, it's like DEFCON, already things have gotten bad. So like I said, right now you're going to be the visionary and the integrator. In a small practice, this is the roles that you're going to hold. This is normal. Over time, we may find ourselves somebody leading a lot more. Now we're going to put that person in the integrator seat.
Hey, Henry.
But yeah.
I love if you could touch on, because I know a lot of people struggle with this, and I think it would be helpful, is what kind of person do you pick for these leads? Because I know our knee-jerk reaction as practice owners is always, let's pick the longest tenured person. Let's pick the front desk person that's been there the longest, the hygienist that's been there the longest. I'd love if you could touch on that. I think that'd be helpful.
Yeah, great point. I'm glad you brought that up. So the instinct, and I was that person too. When we first started this, in maybe 2 years into practice, we probably were at a point where we had 20 team members, maybe. And I'll give you an example for the dental assistant team lead. I picked the person that had been there the longest, right? And I thought that was going to be the person I was going to pick. Well, at that time, I had somebody helping me, a mentor, like we all should have mentors. And my mentor did some personality testing on the team members. And it turned out the person I thought was going to be the dental assistant team lead was not going to be a good one because she had poor follow through skills and was too much of a fact finder in certain things. So that's a great question. A lot of it goes on core values, like who is just a good person. Don't go by skills, go by good person and somebody who can get things done. Colby testing is a good way to get that. You know, you want somebody with high follow through and low and medium quick start. If you don't know Colby testing is somebody who's a quick start is somebody who starts a lot of shit, starts a lot of projects, but if they have low follow through, they don't ever finish them, right? So it varies, right? And you have to tell your team. So that person that I'm talking about, that dental assistant, she got very upset. She just thought it was normal for her to, I've been here the longest. I'm the oldest. I'm the most tenured, right? Why shouldn't I be the leader? And I had to have a conversation with her. It's not about your skills. It's about this position requires somebody who has these skills. So does that answer your question, Paul? Did you want to add something to that?
Yeah, I think that's great. And I'd love to touch on the thing is that a lot of people, when we present this to our teams, regardless of whether you're doing EOS, but just leads in general, is I always think it's very important to start off with that there is no raise associated with this position. Now, eventually you will take care of that person. They will become so valuable to you. But to lessen the resentment, and you can disagree with me if you want, Henry, but to lessen the resentment, I like to publicly say, hey, there is no raise that comes with this because people are like, I don't like this. I should be this. I've been here longest. You're trying to reduce the resentment. This is a good thing for the team. So was presented as such.
Yeah, so I'll agree and I'll disagree, right? So what I'm trying to do in the beginning here, and this is what all of you should do if you're going to implement this, is you're going to like talk about all the benefits, right? Hey, you're going to be in charge of your workplace. When we do this, and this is the next step I was about to get into. When we do this, we're going to commit to have weekly meetings, right? Once a week, you're going to set a time. It's non-negotiable. It's always going to, and when you have a small team, these meetings may take 20 minutes, right? So it's a little bit more time you'll have every week, and you can eat lunch with it. So, hey, you're getting paid for lunch. You're getting a little bit more money right there. But also, once we have this in place, we're also going to do quarterly and yearly meetings. And even in the beginning, I made the yearly meeting like a fun thing. Like, hey, we went out to a nice restaurant. Or as we grew over the over time, we've done uh, the mountains of North Carolina. We did like a weekend. We've done a cruise. We went to Savannah. We've gone to Nashville. So we make it a fun weekend. So it's kind of like a reward. All the hard work you've done, I let them bring their spouses and stuff. So there is a reward for this, but not, it's not just like you're getting a raise of hourly rate, right? But you're in control of your work environment. We're going to meet. I'm going to trust you, right? We're going to make our workplace better. As we've gone along, maybe a few years later, we have a quarterly bonus for the office. Well, if you're on a leadership team seat, then you get a double share. So there actually is a financial benefit, but I didn't do that right away. I did that down the line. If you're starting, because that's where we're tailoring this to, if you're starting, then just talk about the benefits, right? You're in control of your workplace. You're going to make your workplace better. And we're going to meet every week. So when we meet, you'll be on the clock, right? So you have to talk about the benefits to start with, right? So now we've met, we've got a little bit of a skeleton team. We've established some core values. Maybe we've starting to put them up in our break rooms and people are starting to see it. We have some kind of cadence where maybe everybody understands it and stuff like that. Some offices will even do like core value shout outs or core value rewards. Like, hey, somebody did a really great job of taking care of that pain in the ass patient yesterday. You know what? That was really enthusiastic. Here's a gift card. Here's a core value reward, or something like that. I think we do core value shout outs, right? So that's something you can do. Now we've got a mission. that we've come up with, and this is all collaborative. Your team has basically come up with this here. Now you're going to start the cadence of L10 meetings. If you don't know, L10 meeting is a weekly meeting you'll have every week. The idea is to be proactive rather than reactive, right? So we don't want things to always stress you out. We want things to come forward. Yeah, that's Paul, you are the man. That is exactly what I was looking for. So the format that we're looking at here, this is the weekly meetings format that you're going to have. I know it's boring. I'm going to try to shoot through this quick so we can really just go to questions and stuff at the end here. But in the beginning, the way that the quarterly meetings have a lot of format to them, and I don't want to get too locked into those, get into the weeds with that stuff. But essentially, what you can do at the end of this meeting is maybe come up with another list. What's working in the practice? What's not working? What do we need to do more of? What do we need to do less of? And those things may come up with like the problem lists. Well, like, gosh, well, how do we fix this? Right? You want the team to get to the point where they're come up with the ideas. When these meetings are coming forth well, they should be the ones coming up with the ideas. And you want to come up with what's called rocks. Rocks are things that take 90 days to accomplish. And Paul and I came up with some really good starter rocks for almost every team that starts this. Right in the beginning, what's one problem that we have as a smaller office? Nobody really knows how to do this. I'm the only one who knows how to do this. Or gosh, people keep messing up this. Well, let's come up with some SOP videos, standard operating procedure videos, right? Hey team, why don't you come up with 1 to 2 videos a week, right? And you have to coach them, right? You're not Martin Scorsese. You're going to grab your phone and how do we seat a patient the right way? Here, let's make a video and show you. This is how we seat patients the right way. How do we use the autoclave? Gosh, people keep messing up the autoclave and it leaks. This is how you do it. And then you can make training easier, reduce mistakes, and speeds growth, right? So everybody who starts this should have that goal of 1 to 2 standard operating procedure videos per week. And the other thing is whoever one of your skeleton crew here is going to be the growth and culture person. What does that mean? That means that person is going to have the responsibility of like, hey, once a quarter, we're going to do an event. Hey, let's put somebody in charge of our social media. I'm not good with social media. I have team members that are great and they love doing it. And I get people all the time telling us about it. So those are some sample things you can do in the beginning. But once you start doing the weekly meetings, you're going to have a check-in. Everybody, hey, how's everything going? Hey, my daughter's lacrosse game was last week. Everything was great. Then you're going to have a scorecard or your KPIs that you're going to measure every week. You're going to see how things are going. What happens is if our new patient, let's do call rate. One of our KPIs is call rate. We want to have 10% or less missed calls every week. Well, hey, last week our missed call rate was, 18. Okay, that's kind of wonky. How was the week before? It was 12. Okay. It allows you to not let a problem turn into a really big one. You can kind of take care of it in the moment. So you review your scorecard, you do what's called a rock update. Everybody's in charge of their 90-day rocks that make the practice better. And if a rock's off track, hey, do you need help with that rock? Hey, we're supposed to do the standard operating procedure videos. I haven't really done one in a couple weeks. Hey, well, why don't we catch up with that? Do you need some help? And then you do what's called the news, reporting the news. What are some good, bad things that have happened in the office? Sometimes if a bad thing comes up, is that an issue? Is that something we need to have a to-do, like to take care of? Hey, room 4 always leaks. Well, we got to get the Henry Schein guy here. Okay. And at the end, you wrap it up. How do you rate this meeting? 1 to 10. That's why it's called an L10 meeting. And as you go through this process here, I'm really, really making it simple. There's a lot more nuances to it, but Paul and I just really want to prompt people to not just keep waiting and get things going because I can't tell you, like I said, I asked 50 people that have implemented EOS and everybody has, like we're doing the core values, similar tallies. The tallies that come up all the time is less stress, able to scale the business. And you know how when you blow up a balloon, like you blow it a little bit and it just doesn't get to that point, and all of a sudden you got to put just a little bit more effort and all of a sudden it pops up? That's the best way I could describe how EOS, took over my practice to the next level. And that's what allowed me to have the freedom to work if I want to and have the freedom to allow my wife and I to move to the beach. I really, really compliment EOS to a big part of that, because or else I would have been that picture that that consultant was up there where I was not making it pretty good. So sorry
Yeah,
about
and
the.
Henry, I'd love to add if I could. I
Yeah, go
think
ahead.
it's what's important is a lot of us we feel like this stuff's fluffy and like, oh, like what's a good teammate? Why do I need to talk about that? It's self-evident. It's obvious. There is so much that can happen culturally in your practice when you start talking about these general expectations of what you want in a team member. You know, like just a great example is like just bringing this up and doing this exercise. Yes, it's obvious, but now it's out in the open. People feel now comfortable pointing out, like, wait a second, what that person did was not really what we talked about at that meeting. So these things, they feel like they're not worth doing, but I assure you, all of us do we do our mission, we do our core values. A lot of us doctors will do this, but what we miss is we don't share it with the team. So we got to explicitly talk about these things if we want to reap the value from them. So that's what, and I think one other thing Henry's pointing out with these level 10 meetings is that it's not you can follow like a very like strict structure, but what's the most important thing is that you're focusing on the most important issues and you're coming up with solutions. You're not bouncing over here and there and then someone's raising their hand. Well, what about the one patient that did that? And it's just all over the place. It's focused and it's focused on outcomes. So I just wanted to pop in and just say that. So back to you, Henry.
Yeah, so I was actually getting to the end here because I wanted to leave some time. And again, I apologize that my internet is just really wonky today by the beach. But I just wanted to get that point across. And Paul and I have worked hard on this here, and I think this is going to be very valuable because we've started to use it with some of our clients now, and we're seeing the values to it. But yeah, so I guess we can leave it for questions or wherever you want to go with this, Paul.
So, okay, so at the end of, do you want to, so we're closing the meeting? Like, do you want to talk about this last part here?
Which part are you referring
The
to?
close strong. So we were just
Okay.
closing off the meeting. I think we're good there. So someone had a
Yeah, so
question.
basically you're just gonna go ahead.
So Adam had a question. Do you assign someone to almost keep the minutes for these meetings, to keep accountable and be able to look back
Great,
at come
great
time for the
question.
next meeting? Yeah.
So I'll tell you what we do. So the visionary, when these meetings come up every week, right? Even if you don't have a visionary, you don't have somebody yet in that seat, you can assign somebody to be the moderator of the meeting, right? And they have the format that we talked about, so it's cut and dry, it's very simple. That person does a couple things. If there's a tangent, somebody's just talking about a incident that happened and they're going off on a tangent, we make it fun. We ring a bell. Hey, that's a tangent. Let's stay focused. We use something called Trello. So Trello is an app and it's free. And we have an L10 app, L10 thing on there, and in real time it has. So my visionary, not visionary, my integrator we'll have Trello up when we start the meeting, and she'll go through, these are our rocks this quarter, these are our issues, because it allows people in real time to pop stuff up, right? Like if there's an issue on our meetings are on Tuesday, and there's some bad thing that happened on Wednesday, and it's becoming a problem. Hey, that leader can put it right there in Trello in real time, and we know that we'll get to it. So we don't really keep like a minutes kind of a thing. We use Trello, which allows us to track things. So we have rocks. So let me say this little point. As you're going through this, if there's an issue or a problem in the office, if it's a problem that can be settled pretty quickly, like equipment problem, that's going to be what's called a to-do list, right? Something that can be solved pretty quickly. Let's say it's a problem that's going to take a lot more effort. Like, hey, gosh, we need to start Sarek in this office because we're getting behind. I feel like we're like Kodak, right? That's not something that's right away. That's a rock, right? That's something that's going to take time and effort, and different people have to be organized to that list there. So we use Trello. Long answer there.
Awesome. Yeah, so if someone's got a question, throw it in the Q&A, throw it in the chat.
And
Happy to answer it. You know, and I'll
and I
just
think
share that this is what we do with our clients. It's like it's not rocket science, but it is tested. It's not just theory. Like these are things that Henry and I have done in our practice. So he's talking about Trello. In my office, what we use is just a shared Google sheet, something that can be updated in real time. I mean, the meeting minutes, like it's good to take notes on meetings so that you can always follow up at the next meeting to see how you did. I think there was a long part of my career where we just kind of flew the meetings by the seat of our pants. We were just like, okay, whatever goes. And we started realizing that things would come up 3, 4 meetings in ahead, and we were like, didn't we talk about this a long time ago? I don't know, did we? So there was never, we would open up a bunch of loops. We would make a commitment to do something better, but then we would never follow up on it and say, how did we do? And there was never like this follow up of how did we do? What can we improve? So you lose the value of doing the meeting if you do that. So you do need some sort of notation of just keeping track of these things. But I like the idea that they're just rocks. Um, one of the things that we do, like, so Henry and I, I've been coaching for 6 years. Henry has been doing this almost 3 years now. And what we do with all of our clients is we want to open up a point where you have more time to work on things like this. So one of the first things we always do when we work with clients is we get them down to 3 days clinical. It's just such an important thing to give you that breathing room to work on your business so that you can focus on these things. Because like Henry said with the balloon, man, when you get leaders in your office that are all pulling together, I mean, things are going to happen fast. Think about that. If you have 3 leaders in your office, or we could just even say two, I mean, you triple your productivity as far as working on your business. And the thing is a lot of people would say, well, I don't want to put someone in this position. I don't want to give them more work to do. Team members like this. They like being the leads because they like the control, they like the autonomy, they love the creativity. And I could tell you, I've done this with so many offices with leaders. I've never worked with an office where somebody's like, I just hate this. I would say, I can't say never. Occasionally, there is somebody who's like, I just can't handle the responsibility. It's not for me. But this is what we do, and this is what we help you work on. So if anyone wants to, jump on a call, hear about what Dental Practice Heroes can do, go to dentalpracticeheroes.com/strategy, and I'll talk to you, and we can go through this stuff. We can just kind of talk about what's possible for your office and what we do. Our coaching that we do, it's only month to month. So you are not locked in. We have no intentions of locking you in and holding you prisoner. Most of our clients stay about 14 months on average, and that's on a month to month contract. So we like to share that with people because we're proud of that. That means that we are providing value to where people want to stay. They can leave anytime. But if that's something that interests you, please, yes, reach out to us, dentalpracticeheroes.com/strategy. All right, so let's see any questions here. All right. Oh, we got our presentation back, Henry. I love it.
Look at that. Oh my gosh. I just wanted to
Let me add
show
one more thing, Henry. I'd love to
you
add one
go,
more thing.
go
Is
ahead.
that I love this idea of inputs and outputs. Okay, so what all your responsibilities as the practice owner, those are your outputs. You got to do dentistry. You might have to do payroll. You've got to deliver things. Now, a lot of the things, there's a lot of inputs in your life. Now, this might be when a team member pops in your room and says, in your office and says, hey, I got to talk to you about this. It might be an email that you open up and somebody's requesting something from you. It might be a patient that is doing the lab is calling and asking for a shade. Things like that. Those are inputs. And most of your inputs will lead to additional outputs. When you set yourself up with a leadership team that now insulates you from all those things coming from your team, they're not to go to you anymore. They are to go to their lead, the leadership person, and that person's supposed to take care of it and only tell you about it if you need to know or they need your support. You dramatically decrease your inputs and dramatically decrease your amount of outputs. I have went through the process of partnering up with a DSO. I was burnt out. I said I didn't want to do it anymore. I wanted to move on. But then I ended up doing this with the leaders at my practice, and I ended up staying. I've been there for 5+ years since I partnered with the DSO. I just can't leave it. It's just too damn easy now. All the parts of practice management that I hated, I now like because I wasn't getting barraged by a million different things from 35+ employees every day. All right, I'm going to pass it back to you, Henry.
Yeah, so while we have just a few moments, I wanted to show some of the things that were visual. So this is what a real implementation meeting looks like. This is a real one, right? See how those posters there? I love how we have the posters and we kind of like we can draw stuff and the team can see it. when we this is what one of the posters that's in our office, we have three of them. So this is what I was talking about. So if we ever have to coach somebody on something they're not doing right, we have to stick with our core values, right? Enthusiastic is one of them. I'm just This is the core value pledge that our team reads every morning. Like when we're done with our stuff that we have to accomplish in our morning huddle, somebody grabs this and they read. Actually, they don't even have to grab it because they know it by heart, right? And I'm just kind of going through anything else quickly here. We talked about vision, accountability chart. This You're going to have these meetings, and let me go to the other part because I did the freaking PowerPoint. I might as well show it a little bit. So this is where we left off there. So basically, like, this is where you start. That's This is the book that you want to give your teammates there, and it's really dummy proof. I didn't say this, but I like to have extra of them in the office because I'm going to assume that we're going to grow, and as we grow, we're going to add more people. So you're going to give this book to somebody else. Um, Talk about setting the vibes for success. So yeah, that was pretty much it.
All right, cool. Well, hey, I don't see any more questions here. Say thank you guys so much for coming. Thank you, Henry, for taking time. I love your PowerPoint. It's absolutely gorgeous. I'm so happy we got to see it.
Thank
I it stinks that it didn't work while you were doing it, but I think we got through it. I think we did a really nice job. The big things I think everyone should hold on to is that this is the way that you run your practice. And this is what makes us different from working with another consultant that just has the systems. Henry, your team is what, like 35, 36, something like that. How big is your team?
Yeah, about 30. The fact that I don't know for sure means I'm a good delegator. I would say about 36, I think.
Yeah, same thing with me. And then we got Steve Markowitz on our team. He's got a team of like 100 or something. He's got six practices. But, this is the stuff. A lot of us know what to do, but we don't know how to motivate the team to get them to do it. One thing that's really worth saying about this whole thing is this whole structure. This is good for patient care. This is going to help us take better care of our patients, make it a better practice. This is good for the team. It's going to make their work environment better. It's going to give them an opportunity to take some ownership and do things in their practice that make it better to take care of anything that frustrates them. They bring it to a lead and the lead addresses it. So this is win-win for everyone involved. And we don't like to focus on this, but this is a big win for you as the practice owner. This was the game changer for me in my life. This was the game changer for me in the relationship with my daughters, the relationship with my spouse. Everything changed when I stopped getting just bombed with a million issues. And I thought it was like, I didn't realize what a bottleneck I was. It was such a bottleneck to the practice. And this is when the practice just exploded and started running so well. And it was just it's an amazing thing. So if you're looking for help on doing any of this stuff, how to get your practice to the next level, guarantee we can help you. I can't think of a single client we haven't helped. This stuff works. We know what we're doing. So check that out, dentalpracticeheroes.com/strategy. Anything you want to close off, Henry, before we say goodbye to everybody here?
No, I think this is key. I couldn't have said it any better. It's the key that has changed my life, and I don't know where I would be without it.
Excellent. Well, thank you all. Everybody have a fantastic weekend. We so appreciate you taking time out of your day to spend it with us. And we'll talk to you soon. Take care, everybody.